always caring for privacy, hand hygiene. Hi, how are you doing today?
I'm good, how are you?
Good. My name is Ashley. I'm your student nurse for the day. Could you verify your name and date of birth for me?
Dana Rains, 31105.
Perfect. Do you have any allergies I should be aware of?
Penicillin?
Perfect. So today I'm just here to do a head to toe assessment. It should only take about 15-20 minutes. Do you have any questions?
Nope.
Okay, thank you for your time. The patient's posture appears to be good. Her mood, she's in a good mood. She's smiling. Good hygiene. She's dressed for the occasion. No foul smells or odors. I don't notice any lines, tubes, or drains. Are you in any pain right now?
Nope.
Nope. If you had to rate your pain on a scale of 0 to 10, what would you rate it?
0.
0. Okay. I'm going to move into neurological. Do you know where you're at right now?
Ashton's Hospital.
Do you know what day it is?
April 9th,
Do you know the year?
2025.
Perfect. So my patient is oriented to the time, place, and date. She's fully conscious and aware of where she is at. Could you smile for me? Face is symmetrical. Your speech is clear. Could I have you grab my hands for me? Will you pull? Then will you push? Perfect. If you do the same for your feet, push like a gas pedal, pull up. Perfect. Equal bilaterally, strengthen all 4 limbs. Now could I have you close your eyes and just let me know when you feel me touch and what limb?
Right arm, left arm, right leg, left leg.
Okay, perfect. Senses are all intact, so everything is looking good with that. So now I'm going to move into cardiovascular. Could I see your hands? Perfect. Capillary refill less than 2 seconds. Same for the feet. I'm going to check your pulses now. Could you focus? Thank you. Check your pedal pulse. Okay. Pulses are equal bilaterally, +3 strength. They're strong and present. And then now I'm going to take a listen to your heart sounds. Your heart sounds were loud and present. I could hear the S1 and S2, and it was between the normal range of 60 to 100 beats per minute. Could I have you look this way for me? Perfect. Could I have you look this way? No jugular venous extension. And then I'm going to assess your carotid arteries. Perfect. Pulses are strong and present, equal bilaterally, and then I'm going to take a listen for any bruise or anything. Everything sounds good. I didn't hear any bruise or any swishing or anything, so that's good. And now I'm going to move into respiratory rate. And the patient's respiratory rate is between 12 and 20. Her chest is symmetrical. I don't see any distension or any retractions. Her breathing is equal on both sides. So everything's looking good with that. And then I'm going to take a listen to some of your some of your breath sounds. Just take a deep breath every time you feel my stethoscope touch. And then can I have you lift this arm? Perfect. I'm just gonna get a few spots on your back. Just do the same thing. Okay, perfect. Your breath sounds are clear and present, and I didn't hear any bronchi or wheezing or anything, so that looks good. And I don't notice any cough present or any sputum, so that also looks great. And now I'm gonna move into an abdominal assessment. When was your last bowel movement?
A few days ago.
A few days ago. Is that normal for you?
Yeah.
Okay. What about the last time you voided?
Like 45 minutes ago.
45 minutes ago? Okay. Was everything normal with that? Color, smell, appearance? Okay. Have you had any issues with incontinence or like overactivity, needing to go a lot?
No.
Nope. Okay, perfect. So can I have you laid down so I can assess your abdomen? And the shape is flat, contours even on both sides. I don't notice any lumps or masses. I do see her aorta sending a little bit, her aorta palpating. So I'm gonna listen to your bowel sounds. Make sure everything's sounding okay. Okay, your bowel sounds are normal reactive, which is really good. I'm gonna palpate, but let me know if you're experiencing any pain or tenderness while I'm doing. Does that feel okay? Any pain or tenderness? Nope. Okay, perfect. And now you sit back up. Can I have you look up for me? Can I have you look down? Can I have you look side to side? Perfect. Full range of motion in the neck. And then I'm gonna have you, can you put your arm out for me? Straight? Can you put it to the side? Can you put it up? Perfect. And then I'm gonna have you do the same for this side. Perfect. I didn't notice any crackles or anything out of the ordinary. She has full range of motion in both of her arms. I'm just gonna check your knees now. Could you just extend your leg for me? Perfect. Everything feels good in the leg. No crackles or anything out of the ordinary. Full range of motion there. Can I have you stand up for me and walk heel to toe? Perfect. Patient has full balance. No abnormalities in her gait, which is awesome. And I've been keeping an eye on your skin throughout the whole assessment. Her skin has been warm, pink, and dry. Some small maculae and papillae throughout the body, but nothing out of the ordinary. No lesions, no bumps, no lumps. I'm gonna assess your skin temperature one more time. Okay, get your lips. Okay, your skin temperature is warm throughout. And then can I see your arms? I'm gonna assess her. Perfect. Really good hydration. Let's go. And then I'm gonna assess for edema. No edema or anything throughout the body, so the skin looks good. Do you have any questions for me? Okay, thank you for your time.
Nope.
If you need anything, let me know.
Will do.
Hand hygiene.
This is Erica Kelly, and this is my abdominal assessment. Hey, Kaden. What brings you in today?
I've been having some really bad stomach pain and upset stomach.
Okay.
Yeah.
What type of symptoms are you having?
I've been throwing up.
Have you?
Yeah.
How long has this been going on?
Like a week and a half, maybe.
Okay. Okay. Show me where your pain is located.
Like right here.
Right, all the way across the middle?
Yeah.
Okay. Is there anything that makes it feel better?
Not really.
No?
No.
Anything that makes you feel worse?
Being in the car, kind of.
Does it?
Yeah.
Okay. Well, let me do an abdominal inspection assessment, and we'll see if we can't figure out what's going on.
Alright.
Okay. If you don't mind, lay back. Rest your head there on the pillow and put your knees up. Very good. So first thing I'm doing is I'm just doing a visual inspection of your abdomen. Okay. Okay, your abdomen is flat, no visible scars, lesions, striae, rashes, or dilated blood vessels. No signs of inflammation or bulges around your umbilicus or your belly button. Peristalsis is not visible, nor are aortic pulsations. Okay. So now I'm going to take a listen, okay? And try to warm up this stethoscope here. So I just want you to breathe normally. I'm going to place my stethoscope in a couple different spots on your belly, and you just breathe normal. So I'm starting in the right lower quadrant. Okay. Then I'm going to move to the right upper quadrant. Okay, bowel sounds were normoactive in the right lower quadrant and hyperactive in the right upper quadrant. Moving to the left upper quadrant. Okay, and moving to the left lower quadrant. Okay, bowel sounds are normoactive in the left upper and left lower quadrant. So now I'm going to listen for any bruits over your aorta. Okay, then your renal arteries. Okay, iliac artery. Then your femoral arteries. Okay. Okay. So no bruits heard over aorta, renal, iliac, or femoral arteries. Let's see. I'll take one more listen. Took these off just a little too early. Okay. Listen right here. Okay. So no venous hums or friction rubs heard over the liver or spleen. Alright, now I'm going to percuss several areas on your abdomen. I'm just going to lay my hands and tap gently. Okay. Let's start here. Tympani from the lower right quadrant up above the umbilicus. Then I've got dull percussion over the liver. Alright, I'm going to measure your liver span. dullness over the liver again. And splenic percussion. So coming down along here. Okay, take a deep breath. Okay. Dullness under there. Okay, you doing okay so far? Okay.
Just a little ticklish.
Okay. Do you have any areas of tenderness? Just in general,
Yeah.
all around? Okay, I'll be easy. So the first thing I'm going to do is some light palpation. And I'm just going to kind of feel around. You let me know if there's any tenderness. Okay. All good? Okay. I'm going to do a little bit of deeper palpation. Just looking for any masses. Have you taken anything at home for your upset stomach?
Mm-mm.
No? Okay. Have you been drinking lots of water?
Yeah. I
Okay.
got this like IV thing.
Look
drink
like a
it.
liquid IV?
Yeah.
Okay. It's really, really important to replenish those electrolytes that you lose through vomiting or diarrhea. Have you had diarrhea as well? Okay. All right. No palpable masses are noted. And now I am going to palpate your liver edge. So I'm going to put my left hand on your back here. You just lay there flat. And I'm going to pull up. Start here. Palpate the liver edge. Okay, take a deep breath. Okay. Now, okay, the spleen is unpalpable. Let's see, kidneys. Deep breath in. Okay, and kidneys are unpalpable. Now, palpating just left of midline for the aorta. Okay. All right, I'm going to ask you to put your knees down and sit up. I'm looking for any costovertebral angle pain. So I'm going to put my hand just here. Let me know if you feel any pain with this. Any pain? No? Okay. Good. Okay, and lay back down, please. Fix your pillow. Very good. All right. Now I'm checking for ascites. So I'm going to start here in the middle and kind of percuss outward. Looking for any signs of dullness. There. Okay, so what I want you to do is take your hands just like this and place them right here, left and right. I'm going to tap on this side. Okay, and do the same. Tap on this side. Okay, you can put your hands down now. All right. I'm going to put a little bit of pressure on your left side. You let me know if you feel pain on your right side. No? Okay. So it's negative Rolfing sign. Now I'm going to have you roll over onto your left side. Good. And take just this leg, straighten out your leg, and stay on your left side. And then pull your leg back this way. Any pain in your right side? There? Okay, good. Okay, now roll back onto your back. I want you to bring your left knee up like this. I'm going to turn. Any pain on your left side? No. Okay. So negative psoas and negative obturator signs. Okay. Last thing, I'm going to check for Murphy signs. So I'm going to have you take a deep breath in again. Any pain when I'm pressing there? Okay, good. All right, well, you did great, and we'll get you all taken care of.
All right.
Okay, thank you.
Thank you.